I'm here to tell you about osteoporosis because we are trying to do what we can to get patients in earlier for early screenings, well before fractures and low bone densities occur. My name is Amanda Boyd. I am the PA that runs our Ortho Central Bone Health Clinic. Osteoporosis is very much known as a postmenopausal women's disease, which it does affect 1 in 2 women, but it also affects 1 in every 4 men, and unfortunately doesn't have symptoms early on. Oftentimes, the symptoms that we see are really when the first fracture occurs and we are diagnosing it in the ER. So we are very much trying to create awareness for early screenings to prevent that from occurring. For men and women both, the fortunate or unfortunate thing about this disease is I have previous athletes that will come in and they have done all of the right things and they have used conservative methods and their vitamin D and their calcium and their weight-bearing exercise, and they've always followed a healthy diet and had great activity, but their bone numbers don't reflect any of that because unfortunately sometimes you can't outrun genetics or the risk factors that you can't control, the unmodifiable risk factors. So I think screening in general is important across the board, even in previous athletes and people that are active and have great lifestyles, because the unfortunate thing about that is there are many cases that even with those individuals, I check their bone densities and I give them a diagnosis of osteoporosis. There's certainly a demographic of people that are more likely to experience osteopenia, which is low bone density and osteoporosis. And those factors include things like family history, smoking, alcohol, more than 3 drinks per day for a long period of time, extensive steroid use for other autoimmune type conditions. We also see a lot of patients that have rheumatoid arthritis. Different endocrine conditions can certainly contribute to how things affect your bones, unfortunately, which is why we certainly recommend a baseline DEXA if you have any of those risk factors to allow us the opportunity to follow then that pattern and ensure we're taking proper care. One of the tools that we use certainly for screening osteoporosis and bone density in general is a DEXA, what we call a DEXA. And it's a very low dose x-ray that we do with a patient to ensure that we are measuring specific points like bilateral hips, the spine, sometimes the forearm, to determine that bone density in those tissues to give us a score. And once we can have those scores and gauge them against levels of bone density in general, we can provide a diagnosis or hopefully provide a normal screening that then we can follow and trend as a patient ages through the course of time. So interestingly enough, the U.S. Preventative Task Force recommends that women over 65 should get a bone density screening. The challenge with that is that if there is any kind of risk factor prior to that age, a baseline DEXA of really at 45 to 50 years old with a couple of risk factors is crucially important, because I'm oftentimes diagnosing or providing a new diagnosis of osteoporosis well into a patient's 70s and 80s, when the reality is a DEXA is a snapshot in time. And so I don't know if they've had these bones for 10 years or 20 years, or if we could have known sooner with a baseline DEXA at 45 to 50 and followed that throughout the course of their natural aging process, if we could have intervened sooner. So I would love to see you as early as 45 to 50 to get a baseline DEXA to help manage your risk factors for osteoporosis and better control a potential decrease in bone density in your lifetime. When it comes to bone loss, there are certainly conservative lifestyle habits that patients can take on that will help to reduce number regression. Certainly calcium management, we encourage patients to get 1,200 milligrams of calcium per day, ideally through their diet if they can. Supplementation is needed. Vitamin D is huge, huge, huge. And then weight-bearing exercise. We really look at safe weight-bearing exercise, stability exercises. Anything we can do to stimulate those bones and strengthen those bones conservatively is tremendously important as well. Unfortunately, if we treat a patient or we're looking at a patient that's come in and they already have that diagnosis, and particularly if the numbers are severe, it's very difficult to do just conservative measures because we're already beyond the point of bones being compromised and an increased risk of fracture, which means that we want to do whatever we can to reduce that risk. And oftentimes medications are then needed at that point. If it goes untreated and a patient starts to unfortunately experience these fragility fractures, they're kind of like dominoes. They seem to continue to happen. And so our goal with that is to do what we can to mitigate that, because our patients are independent and want to maintain maintain their independence and their activities of daily living, and not have to sacrifice those just because they're limited in the fragility of their bones. And so whatever we can do to strengthen their bones, reduce the risk for fracture, allow them to continue to be independent and maintain a healthy lifestyle and go on living the life they want to live, that's ultimately our goal. So thank you for watching, and we'd love to see you at the Ortho Central Bone Health Clinic for your bone density screening.